Welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today I'm joined by Dr. Tim Harlan, and we're going to be talking about health as food and an initiative that you have going on called Culinary Medicine. So welcome, Dr. Harlan.
Great to be with you. How are you?
I'm doing well. So maybe before we get started, if you could just introduce yourself and tell us kind of how you got into culinary medicine.
Yeah, my name's Tim Harlan. I'm an internist by trade. I practice medicine at George Washington University and have been standing at the intersection of health and food for about 35 years. Prior to becoming a physician, I was a chef and a restaurateur. I actually started working in the restaurant business as a teenager and managed my first restaurant at 18. I owned my first restaurant at 22. I closed that to go to college to get a hotel and restaurant management degree, and took a wrong turn one day and ended up in medical school. And that was in the mid 80s. And, during that time, prior to the mid 1980s, we actually had very poor quality nutrition research. It's gotten tremendously better in the last 30 years. And one of the things that I noticed when I was in medical school was that, physicians, healthcare professionals really weren't talking about food very much. And so I wrote my first book while I was in medical school. And one thing has led to another over the course of the last 30 years. I have a fairly popular website called drgourmet.com. And in the last 10 or 12 years, the idea of culinary medicine, of helping teach practicing healthcare professionals, medical students, nursing students, how to cook and eat healthy, and how to help them share those ideas with their patients has really come to the forefront in our profession as another tool in our toolbox to help our patients be as healthy as possible.
Yeah, I agree with you. I think nutrition is probably one of the most overlooked aspects of trying to help someone to get well, but it's the building block for everything that we do.
Yeah, and in our defense, it's not really been, as physicians at least, it's not really been our job. We have focused on, what we call episodic care or acute care, interventional care, where you come in, I see you, you come back 3 months later. But now I think that, we've gotten really good at that in the last 35 years or so. And so during that 35 or 40 year time span, there's been this incredible rise in nutrient poor, very poor quality food. And having that skill set to be able to help our patients just is more important now than ever.
So when you say the term culinary medicine, what does that entail?
Well, it's a great question. I think, the way that that most of us in this arena, in this discipline, use that term, it really is just the idea of making food part of the discussion and part of our therapy. And I don't want to mislead people. People use the term food as medicine. And I will say I'm not real personally fond of that term, because it indicates that maybe you can take this particular ingredient or this particular food and it will treat a particular disease or a particular condition. And, really the research doesn't show that that's the case. So what this really means is, if you come to see me as a patient, I've got things in my toolbox. How am I going to discuss your diet with you? How am I going to break that down in a way that I can help you understand how to structure your eating better? How can I use that information to advance your health? Not instead of necessarily the medication or other therapies that we have, but certainly as an adjunct to and alongside of that. So what we know from the research and the literature is that things like cholesterol-lowering medications, super effective at preventing heart attack and stroke. And eating really healthy, super effective against preventing heart attack and stroke. When you put the two of those together, they're synergistic. 1 + 1 equals about 2.6. So you get more bang for your buck. What it means a lot with our patients is that that healthcare providers, healthcare professionals across the country, whether that's hospitals, individual physicians, academic faculty practices like here at GW, we're actually teaching our patients how to cook. And so the Health Meets Food programming has courseware that teaches medical students and practicing physicians, nursing students, et cetera, how to cook, how to eat healthy, but also in those courses, how to have that conversation with your patient. But then at the same time, I also have it in my toolbox to be able to send my patients to a series of hands-on cooking classes that are about 2.5 hours each. There's a 6-module beginner series, for example. There's programming for kids, for adults, for families. How can we also not just talk about it, but show our patients how to cook and eat healthy?
Okay, and so is that a program that's online or?
Well, it is right now. You know, prior to this time last year, all of these hands-on cooking classes, there really weren't any offered here at GW. The program was kind of new and getting started, but all across the country in places like Memphis and New Orleans and California, people, medical schools are offering hands-on cooking classes. Those were in person in a teaching kitchen, and that's certainly where we will go to here at George Washington University. But for the last year, we've done all of that programming online, both for the medical students, for our internal medicine residents, for practicing physicians in what's called continuing medical education, and not just physicians, nurses, nurse practitioners, dietitians, pharmacists. We're pretty broad in who we offer that programming to. But then we also began in July of last year, adapted this hands-on cooking courseware for the virtual environment using Zoom, just like you and I are here today. And it's fabulous. It's an amazing environment. And we're offering 2 classes a week right now, one on Tuesday evenings and one on Saturday mornings for the community.
Okay, so is the culinary medicine movement something you started? Because it sounds like it's a pretty big initiative, or was it something that you found and have tapped into?
Well, so that's a really interesting question. I don't think it's, I think the idea of teaching kitchens in medical schools, which is where I kind of came to this discussion. My former dean at Tulane University, when I was on faculty at Tulane, a fellow by the name of Ben Sachs, back in 2009, so now, a good 13 years or so ago, came to a group of us, faculty members at the medical school, and said he wanted to build a teaching kitchen to teach medical students how to cook. At that time, that was a pretty alien concept. That was, and certainly not my idea. I came to the table because I had this background in food and had been writing about food for a few decades. We did end up building that teaching kitchen, and in that process, the team built courseware again for healthcare professionals and the community. Slowly but surely, a number of medical schools and academic medical centers, hospitals, nursing schools, dietitian programs, et cetera, have adopted and used the Health Meets Food courseware, which has expanded. There's a lot of courseware that we offer now for professionals, but also the community. And so right now, the courseware is used in about 60, a little over 60 academic medical centers across the country. So in that respect, I've been, a participant in all this, and I think we here at GW are in very much the thought leaders in this area with the research that we've done, with the curriculum that has been built, the team that we have in place here. But I wouldn't say that I founded this per se. If anybody has responsibility for this, it's Dr. Sachs. And it really wasn't, I mean, the idea of culinary medicine wasn't his idea per se.
Okay, but it kind of is, so it's grown over the past 13 to 14 years. We have these 60 sites. So even if someone's not in the DC metro area, you know, they can go to your website and find.
Yeah, so the Health Meets Food team, the group that helps manage this courseware, has a website at culinarymedicine.org. And there is information there about what sites across the country offer this programming. And basically what this programming does, both for the professionals and community members, is it uses Mediterranean diet principles, which are really simple. It doesn't mean Mediterranean recipes, but these principles that are in research that we use as part of research tools to help, but we translate those for the American kitchen. And those are pretty simple principles: more vegetables, more legumes, more fruits and nuts, more whole grains, more seafood, better quality oils and fats, a little less dairy, but really good quality dairy, and then less land animal protein, less meat, and alcohol in moderation. Those are the 9 essential points of the Mediterranean diet. So we translate that for the American kitchen. We translate it into tacos and red beans and rice and spaghetti and foods that are familiar to people. And yes, all across the country, you know, if you're listening in from, say, New Orleans, you can go to culinarymedicine.org and you can find whether or not one of the medical schools or hospitals in your area is offering programming. For example, in the Bronx, the St. Barnabas Hospital program, they have a teaching kitchen there now. In Grand Rapids, Michigan, at Spectrum Health, they teach their residents and they teach their community. So all across the country now, I mean, I can think of, you know, dozens of teaching kitchens at medical schools and hospitals, and more are being built every day. So I think there's not just opportunities here in the DC area, but there are tremendous opportunities for folks all across the country. Likewise, you know, for the professionals out there who are listening in, you know, the programming offers continuing medical education as well as a certification. It's a pretty rigorous 60 credit hour study program with a certification exam in culinary medicine.
Okay. So we've kind of talked about the history, where we are today. And so looking forward, what do you think the future is for culinary medicine?
Well, you know, it's a really great, it's hard for me to answer that, because if you had have told me, you know, 10 years that you and I would even be sitting here having this conversation, I might have laughed at you. Certainly, I think if you had have said, oh, you know, the programming that's you know, you're working on right now is going to be used by, you know, dozens of medical schools across the country, that there'll be almost 200 certified culinary medicine specialists, that we would have, you know, we have a conference every year that draws 300 people. I mean, I wouldn't have believed it. Like, I just would have said, yeah, okay, sure. So it's a little hard for me to predict. I do think that, you know, the idea 13 years ago of building a teaching kitchen seemed very alien to me. And now I really do believe that pretty much, you know, maybe not in my career, but in my lifetime, I think we will see an environment where every medical school and probably almost every hospital has programming like this, has a teaching kitchen, is making teaching patients, community members, their own staff, their own faculty, their own physicians, their own nurses, teaching them how to cook great food that just happens to be great for you. So yeah, I think that's the sort of bold, you know, pie in the sky future. Our future here, you know, in the next few years at GW is, you know, the dean here and the university have been amazingly supportive of this program, bringing this program here, and building out a very robust program. We, you know, prior to the pandemic, we were working with the folks at the School of Nursing on programming. We were working with community members around town, other community organizations. I think as we get back more towards normal, our big goal here is to continue to do the research needed to show what works best, both for the professional courseware and programming, but also for the community courseware, the community cooking classes. And we have that research ongoing. We've got a great collaboration with a group at the National Institutes of Health. And there's great research on the website that folks who are interested can find. There's a research section there with our published research about this. We know this helps people be healthier. We have the data that says that. We just want to strengthen that information, strengthen that research. We also use that research to refine the courseware, make it better, make sure that we're helping people be their best.
Okay, so you mentioned the Culinary Medicine Conference, and there's one coming up in 2020, June 4th through 6th. And so it's targeted for healthcare professionals, but also people in the community. So what are some of the topics that'll be discussed? And we're going to put a link for people to register if they were interested on my website, and they can find you on your website. But
And again, if folks are driving, that information is also at culinarymedicine.org. The conference started this will be the 7th year, the 7th conference. Skipped last year, didn't have a conference. I think that was pretty normal for 2020. Each year that we have the conference, we have really terrific speakers, and usually that kind of sets the theme, if you will, for next year's conference. We sort of take what we learned last year and decide, okay, how can we answer questions that people had? And one of the sort of big theme this year for us is culture change, is how do we, especially in healthcare, change the cultural environment for ourselves that helps us deliver this programming and deliver culinary medicine and nutrition type programming for our patients. Our keynote speaker is a New York Times bestselling author, Dr. Marion Nestle, who's going to talk about the food industry. Our Saturday programming includes another in my world, another rock star, Dr. Robert Lustig, who is an expert is a pediatric endocrinologist at the University of California, San Francisco, and who really has done a lot of work in the tremendous impact that sugar, especially high fructose corn syrup, has had on the obesity epidemic in America, and what can we do about that? But we also have folks from industry coming to speak about how they're changing the culture of their companies, how hospitals are changing their culture. So that's kind of the overarching learning moment, if you will. But then we have hands-on cooking classes that'll all be done via Zoom and skills building sessions. A pretty exciting conference for us, especially because we're going to do it virtually. We've been doing virtual programming now for a year, and this will be the first time we've done a virtual conference. But I think we're comfortable enough with this environment that it should go really well. We're really excited about it.
Yeah, well, I'm excited too. I'll be joining you.
And I will say you're going to be there helping moderate one of our skills building sessions for how can we optimally help our patients who need different textures, say kids as well as older adults who might need foods of different textures to help them eat. So, we'll have dietitians, nurse practitioners, people who do this kind of work, teaching practical skills like you will be.
Right. I think that it's the skill building part that's unique to me. It's not often usually you go to a conference and you sit there and they just give you information. You don't actually get to apply it or work with it in any way. And so I know for our session, it's taking someone from like a regular diet through like, how do you make it mechanical soft, to how do you puree it, and how do you do that as a family caregiver with competing demands? Because I think that's the type of skills that people need. We can tell you, well, they have to be on pureed diet, but then we don't tell you how to do that or what that means. So I think that's a really unique aspect of the Culinary Medicine Conference. And so,
Yeah, and
Go
I
ahead.
think that, it's a really interesting thing because when we started this project, and when you think about, for most of us, physicians, nurse practitioners, physicians assistants, nurses, et cetera, when we're talking about food with our patients, most of the time they think we're talking about, and I'll use the big air quotes here, heart healthy diet. But the fact of the matter is that, food touches so much of what we all need. I mean, it's our shared experience. It's our universal experience. My elderly patient, for example, is going to need something very different than my pediatric patient, than kids. Patients with HIV have very special needs, for example. And then, celiac disease or acid reflux. So you might have, as an internist, I might have a patient who comes in and they've got high blood pressure and maybe some, problem with their blood sugar. And I want to fix that. But, oh, by the way, they also have a peanut allergy and they have celiac disease or acid reflux. So it's not just this kind of one size fits all. We need to know a lot about food in our profession to help our patients be their best.
Yeah, I mean, that is one thing about when you look at most cookbooks, it's like a heart healthy or like no sugar if you have diabetes, but what if you have both,
Yeah, well, the answer to that question is fortunately, Mediterranean style diet. We know that it is by far and away, and the most studied, both in what we call observational studies, where we are looking at populations like epidemiologic studies, but also in controlled trials where we assign one group to a particular diet and another group to another diet. It is by far the most studied and clearly the most efficacious. There's a lot of kooky diets out there, and our patients, come in and they want to know about those kooky diets. So we help them understand, say Ornish or, South Beach or Zone. And most of those diets are not sustainable for our patients. They come in, they want to lose weight, they want to be on a diet, they want something easy. And sometimes that can really help them get jump started, but keeping them going on something that's sustainable for them and that can really be a diet they can live with, or a way of eating that they can live with is critical. And I think it's just become a really critical part of our profession now.
Right. And I think that it's not so much, I mean, there's a diet that you go on, and then there's your diet, which is what you eat. But the diet that you eat is really part of a comprehensive lifestyle. And, I think that giving people that basic skill set for lifestyle change, permanent lifestyle change.
And again, that meets them where they live, with tacos, with, red beans and rice, with pizza, with, foods that they are used to eating, but done in a way, still fabulous food, but just helping folks think about that a little bit. Yeah, think about that a little differently.
Yeah, I mean, it's tweaking. It's like, here, what are the foods that you normally eat, and here's how you can tweak those to, for a sustainable lifestyle that is good for you in all aspects. So we have the conference coming up. You've got the Certified Culinary Medicine Specialist program, and then you also offer free CMEs on your website.
There is some free CME on the website from some webcasts from some of our past conferences. We do have some programming coming up probably around the end of this month that'll be free for practicing healthcare professionals in food insecurity. Really important topic for us. We're building a set of courseware with five different lectures or 5 different modules on food insecurity. The first 2 will be released before the end of this month. The first one is on food insecurity in the elderly in our older population, and the second one is on the SNAP and WIC program. About 12-13% of our patients don't know where their food is coming from in the next week. And it's a really critical problem for us, and something that we very much need to educate ourselves on. It's one of the reasons we're making that continuing medical education free, because we think it's important enough that we should, that every healthcare professionals should learn about these topics. It's really critical. We have actually begun introducing it just this past week into the medical student courseware and our other professional courseware. So lots there at culinarymedicine.org. If folks in the DC, Maryland, Virginia area are interested, we do offer cooking classes here to our patients and our community members, and folks can go and sign up at culinarymedicine.org/community. And there's a sign-up sheet there. We are working towards building. Our plan is by the end of this year to be offering at least, our hope is a cooking class every day of the week via Zoom.
Okay. So even if you're an external provider, your patients could tap into that you could refer them to this as a resource.
Oh, yeah. I think that that this is just a super important thing for our community, especially here in DC, to make certain that we're helping folks be as healthy as possible. And it's really great. One of the cool things about this is that, food also cuts across everything, all different lines, cultures. We have folks from all over, all different walks of life. Somebody, who might be the head of manufacturing of a tech company, or a nurse, or a grocery store clerk, or people who would never cook and eat together. And that's pretty cool. I think that's just really fun, because people who might not get to know each other, there's that really neat social aspect of this that really breaks down a lot of barriers also.
Okay. And then you also have a newsletter, which I love the name.
We do that. You keep saying all this stuff that we do, and I'm like, wow, we do that. There is a monthly newsletter that people can sign up for at culinarymedicine.org. Most of that is, alerts people to when there's different programming, research that's being published, sharing, small biographies of our colleagues across the country, what different culinary medicine sites are doing, et cetera. And there's a sign-up sheet, again, sign-up sheet at culinarymedicine.org. Seems like I've said that about 10 times now.
It's all good. So the newsletter is called Zest. So I
Yes.
just love it when names fit. So, okay. Well, thank you so much for being with me today, Dr. Harlan.
Thanks for having me. It's been really great being with you.
Yep. I'm excited about the conference coming up and hope that we'll have a big turnout. Like I said, our session will be intergenerational, so it'll be fun to see, all the different generations cooking together. And so I'm looking forward to it.
Yeah, I was really excited when you told me, about what y'all were planning. Really excited, very unique, and I think a cool approach to this not problem, but this solution, if you will.
Exactly. Okay, thank you so much.
Good to be with you. Be safe.
Thank you for joining me for this week's episode of This is Getting Old, Moving Towards an Age-Friendly World. You can find more episodes like this on my YouTube channel, Melissa B. PhD, and don't forget to subscribe. You can also visit my website, melissabphd.com, and check out the podcast and blog section, because that's where I put all the hyperlinks and different things that we may talk about in any given episode. You can follow me on social media, Twitter, LinkedIn, Instagram, and Facebook. And you can also find the audio version of the podcast on iTunes, Stitcher, Spotify, and Amazon Music. So I hope this podcast gives you ideas of different things that we can do to move towards an age-friendly world, because when the world is age-friendly, it's friendly for everyone.